So this is part 2 of Autism 101, where we are talking about the basics of autism. What is autism? What are those early signs? And now in part 2, we're going further into how is it diagnosed and what are the best next steps for parents who are starting to have concerns. So if you missed part 1, make sure you check that out. Also, don't forget, if you have not yet downloaded your free autism checklist, where we pull together in a really easy format for parents a quick checklist of some of these common things that you will see both in younger and older children with autism that you can use if you're having some concerns, as well as to talk to your pediatrician and the best next steps for parents. So you can get that at www.warriorfamilies.com/autism checklist. Now let's jump into part 2. As far as diagnosis, it's a challenge. So typically the most common providers that you will see to provide an actual diagnosis of autism is going to be a neurologist, a developmental pediatrician, a psychiatrist or psychologist. When we took our sons when they were 2 years old and we saw a neurologist, we were in the room with him for 20 minutes, 30 minutes. And between interviewing us, talking to us a lot about our concerns and challenges, and just interacting with our boys and playing with them and observing them, we walked out with a diagnosis of autism. While that still can happen because there are, there is a set of factors that they look at, and if your child has a certain percentage of those factors, then your physician, the neurologist, developmental pediatrician, any of those may just give them a diagnosis of autism. However, when it comes to insurance, a lot of the insurances are requiring a actual diagnostic tool, a full diagnostic assessment to be given in order to cover some of the therapies and some of the treatments for the child. So now a lot of times, instead of providers just giving a diagnosis based off their observation and their interviews with parents, they are doing full-on assessments. And that's something, for you as a parent to decide and to talk with your providers about. In general, the team diagnosing your child ideally is a team. So it may include a neurologist, a developmental pediatrician, a psychologist, a psychiatrist, a speech language pathologist, an occupational therapist. Typically, there can be one to multiple of those that together, between their observations, their assessments that they do, say your neurologist is heading that team, they may still be taking in assessments that your speech language pathologist did into consideration with giving the diagnosis, or assessments that came over from the psychologist that you've been working with. And together as a team, they are making the diagnosis. So as far as the actual diagnostic tool, there are lots of information on screenings and our developmental milestones. As you're getting closer, you're watching your child's milestones, and there's so many great resources when it comes to that. And you're starting to see maybe some different areas that there's delays, that you have concerns, and you're bringing those up to your pediatrician. Maybe you get to the point where between the delays that you're seeing with your milestones, maybe they then get to the point that you're doing an autism screening, an official autism screening. Again, there's more posts and information and really easy resources on those too. So you may bring to your physician, to your pediatrician, you may bring your milestones checklist, you may bring the autism screener that you filled out and bring it to your pediatrician and talk to them about your concerns. And then they may then refer you, ideally, depending on how they feel about the results of all of that, may refer you to most likely a neurologist or to a developmental pediatrician. That's typically the way it goes, but it could also be a psychiatrist or a psychologist. So assuming you go to a neurologist, they are going to then take that same information and kind of do this two-part diagnosis. It can just be through those screenings, assessments that you bring from your other providers, and their own observation. They're going to ask you lots of questions. They're going to talk to you about what you see at home, and they're going to ideally play with your child and engage with your child and make their own assessments. They may give you a diagnosis right from there, or tell you that they don't feel a diagnosis was appropriate. Or you may decide to go to that next step of doing the full diagnostic tool. So we will have a full separate section just on the the diagnostic tools and what they are and what they include and what to expect. Typically, it's very often they're not covered by insurance. They can be lengthy, they can be expensive. So that's kind of what we're going to do, a whole different section on that and interview some of the providers that do perform them. But in general, the 4 most common ones is the Autism Diagnosis Interview, or the ADI, the Autism Diagnostic Observation Schedule, or the ADOS. That's probably the most common one that most of you have heard of, if you've heard of any. I think that's probably the most common one given, is the ADOS, the Childhood Autism Rating School, or CARS, and the Gilliam Autism Rating Scale, or GARS. So in our post, you'll see information on those, some more specifics on those, and some links to more details on those if you want to look them up. But that would be the other piece of the diagnostic, of getting the diagnosis, if you choose to go that way, is doing a full assessment. And that's a much more formalized assessment that at the end, based off the results of that diagnostic tool, as well as the results from your provider's own observation and assessment, the screeners that you may bring in and their interview with you, all of that together your provider would be piecing together to make the determination of whether or not they're going to give you your child a diagnosis of autism. So that's where we're going to leave this at for now. Again, in the post, there's a lot more detailed links. If you want to really dig into more detailed information, feel free to come in and ask more questions if you want us to come back with more information. But hopefully at least that gets you through some of the basics of what autism is and how you navigate this very beginning piece of it. The one piece I would say is to just know, and we talk about this more in our posts when we're looking at just developmental milestones and the screenings, but you are your child's parent, right? You know them better than anyone. So we hear from a lot of parents who are just frustrated because they have concerns, they see delays, or they just see things that concern them and they bring it up to the pediatrician, and maybe the pediatrician is not very receptive to it. So just know you have the ability to advocate for your child. This may be your first child and you don't have anything to compare it to, or maybe it's been, maybe they just present so separately from other children that you've had. Every child is different, and just because they show some of these signs or present with some of these challenges, it does not mean that they have autism. But we know that no matter what, when a child has a delay, it only helps to get them help. Whether it's just talking to a therapist who can give you some strategies to work on at home, to getting them started with therapy, to just talking to other parents or other providers. Don't be afraid to reach out, ask more questions, ask for that referral. If you're not happy with what your pediatrician is saying, get a second opinion, or ask for the referral to a neurologist or a speech therapist, or someone that can just give you their opinion. There are so many therapists out there that will do screenings. They're just screening. They don't tell you, they don't diagnose, and they don't tell you all the answers. But just don't be afraid to advocate for your child and to ask questions. And if you don't know what questions to ask, that's why we're here. So reach out, let us know how we can help and what other questions you have that maybe we didn't answer here. I hope you found this video series helpful. Please comment and like below, and don't forget to subscribe to our channel so you don't miss more of our videos. If you missed part 1, make sure you jump back into part 1 and let us know in the comments how else we can help.